Okay.
So for our presentation, we're doing it on the bacteria pneumonia. So let's begin with understanding what bacterial pneumonia is. It's an infection of the lungs that's caused by bacteria. Now, the key part of this infection is that it leads to inflammation in the air sacs, which is also called the alveoli, where there are tiny structures in our lungs where oxygen exchange happens. When these air sacs are inflamed, they can fill with fluid or pus. This blocks oxygen from getting through, which is why someone with bacterial pneumonia might feel short of breath or experience chest pain when they breathe or cough. Pneumonia can either affect one lung or both, and the severity of the infection can vary for many healthy adults. It might be mild, but it can quickly become serious, particularly for people who have weaker immune systems, the elderly, or very young children. Most of the common bacteria that causes pneumonia is Streptococcus pneumoniae. This type of bacteria is responsible for a majority of community-acquired pneumonia cases. However, other bacteria can also cause pneumonia, including Hemolynus influenzae and Mycoplasma pneumonia, which often cause milder forms of the disease. There's also Legionella pneumonia, which is a bit different. This bacteria causes a more severe form of pneumonia called Legionnaires' disease. You might have heard outbreaks linked to air conditioning systems or contaminated water sources. Now, who would be at risk? Pneumonia can affect anyone, but certain groups are more vulnerable. This includes infants, the elderly, smokers, and people with existing lung conditions like asthma or chronic obstructive pulmonary disease. Smoking damages the lungs, which can make it easier for bacteria to take hold. People with weakened immune systems, whether due to chronic illnesses, HIV, or treatments like chemotherapy, are at a higher risk because their body cannot fight off this infection. People with weakened immune systems, whether due to chronic illnesses, HIV, or even treatments like chemotherapy, because their body can't fight off these infections that well, it causes them to have their symptoms a lot more worse than what most would be if they had healthy lungs. Lastly, we need to remember that hospital-acquired pneumonia, patients in hospitals, especially those on ventilators with a prolonged stays at a greater risk for developing pneumonia due to a weakened defense or exposure to more resistant bacteria. So the Mycoplasma pneumonia causes atypical pneumonia, which is often referred to as our walking pneumonia. Because patients may not feel severely ill, this organism is unique due to its lack of a cell wall, making it resistant to many common antibiotics that target cell wall synthesis, such as penicillin. It primarily affects the respiratory tract, leading to inflammation of the lungs, which can result in symptoms that range from mild to moderate. The bacterium is spread through the respiratory droplets when an infected person coughs or sneezes, and it can be transmitted through close contact with an infected individual, which is why outbreaks are common in crowded environments like schools or military barracks. The incubation period is typically 1 to 3 weeks, meaning individuals may be contagious before showing symptoms, complicating efforts to control outbreaks. Klebsiella pneumonia is a gram-negative bacterium that can lead to severe forms of pneumonia, particularly in those with underlying health conditions, such as diabetes or chronic lung disease. This bacterium can cause both community-acquired and hospital-acquired infections, often resulting in a more serious complication. Infections may be present with symptoms such as a high fever, chills, and cough that produces a thick, mucid texture inside your lung. Patients may also experience some chest pain and difficulty breathing, which can cause a respiratory failure if not treated properly. Transmission often occurs in healthcare settings where it can be acquired through direct contact with contaminated surfaces, medical equipment, or even inhalation of the presence of these infected individuals. Klebsiella can also be involved in aspiration pneumonia, particularly in individuals who may accidentally inhale oral gastric contents in their lungs. This risk increases those who are impaired swallowing, such as alcoholics.
Pneumococcal pneumonia is caused by the bacteria Streptococcus pneumonia and is seen in the form of pneumonia, meningitis, bacteremia, otitis media, or sinusitis. It is very easily spread through direct contact with respiratory secretion like saliva or mucus, which is why it is the most common form of pneumonia. There are no specific percentages to track because there are usually a lot of other factors to consider, and many people do not report cases. The symptoms of pneumococcal pneumonia are fever, cough, chest pain, shortness of breath, low appetite, light sensitivity, and drowsiness. The treatment of pneumococcal pneumonia is mainly antibiotics. With mild infections, fluids, pain relievers, and rest are vital with recovery. And the recovery is usually very short with the use of antibiotic treatment. In cases of severe infections, hospitalization could be required to track the patient's well-being and prevent chronic illness or disability from developing. Inside the lungs, resident macrophages and dendritic cells are the first line of defense against pneumococci, especially alveolar macrophages, which play a direct role through the ability to phagocyte and kill pneumococci. They also have immunomodulatory functions that limit inflammation through the removal of dead or dying neutrophils in the lungs.
Klebsiella pneumonia is a gram-negative bacterium and has a thick protective polysaccharide capsule that helps it evade the immune system, making it highly virulent and resistant to antibiotics. This capsule also gives the bacteria a smooth, shiny appearance when cultured. As a facultative anaerobe, it can survive with or without oxygen, and it primarily colonizes the human intestines, but can infect other areas, especially in the vulnerable individuals. Klebsiella pneumonia is a bacteria known for causing severe pneumonia, particularly in hospitalized or immunocompromised individuals. Symptoms include high fever, chest pain, coughing, and thick blood-streaked mucus. Beyond the lungs, it can also cause infection in the urinary tract, bloodstream, and wounds. Its high resistance to antibiotics makes Klebsiella infections challenging to treat, posing a significant risk in healthcare settings. When body's immune system detects these bacteria, the first cells to inhibit it are neutrophils and macrophages that inhibit Klebsiella pneumonia by engulfing and killing the bacteria. Natural killer cells help target infected cells, and T cells support and enhance this response. Klebsiella pneumonia is the leading cause of hospital-acquired pneumonia, particularly in intensive care units and among immunocompromised patients. In community settings, it is less common but can still affect individuals with conditions like diabetes or alcoholism. Globally, the prevalence is higher in developing countries due to factors like overcrowding and poor sanitation. Additionally, the rise of multi-drug resistant strains, especially Klebsiella pneumonia, poses significant public health challenges. Pathogenesis of Klebsiella pneumonia has several virulence factors that contributed to its ability to cause disease. Capsule production helps it evade the immune response. Adhesins facilitate its attachment to host tissues, and lipo-oligosaccharides assist in avoiding immune detection. Moving on to treatment, first line of treatment is antibiotic therapy. Supportive care is crucial and may include oxygen therapy for respiratory distress, fluid management, and mechanical ventilation if necessary. The outcomes associated with Klebsiella pneumonia infections. Mortality rates can be high, especially in severe cases and among patients with multi-drug resistance, exceeding 50%. Complications such as lung abscesses, sepsis, and ARDS are also common. While many patients can recover with appropriate treatment, the presence of antibiotic resistance complicates these outcomes. Survivors may experience persistent pulmonary issues.
Mycoplasma pneumoniae. The bacteria itself lacks a cell wall. It replicates by binary fusion, and it has an adhesin protein complex, which allows it to stick to its surroundings. It primarily sticks to the epithelial cells of the respiratory tract, and it cannot be seen on light microscopes. Signs or symptoms would be dry cough, sore throat, fever, headache, or fatigue. These usually come in during the third or second week. Its incubation period is 2 to 3 weeks, and it can proceed to chest pain or difficulty breathing. It is most prevalent among young people, and it is highest of infection in crowded areas. It infects via the respiratory tract, and using its adhesion proteins, it attaches to the epithelial cells. When its treatments are antibiotics that are now focused on the beta-lactam and microslides. There are no vaccines available for Mycoplasma pneumonia, and once cured, the immunity is only temporary for a maximum of 5 years.
Pneumococcal vaccines. There's two types of pneumococcal vaccines that target Streptococcus pneumonia. And the first one is PCV15, and this vaccine is recommended for children younger than 5 years old, 19 through 60 years old adults with health conditions who never received a PCV vaccine. Also, adults over age 65 who never received the vaccine, and children aged 2 to 18 with certain medical conditions such as respiratory disorders may require second dose of the vaccine. The second vaccine is the PPSB23, recommended for children ages 2 through 18 and who took the PCV15 and have certain medical conditions. Also for adults over the age of 19 who got the PCV15. The pneumococcal vaccines target Streptococcus pneumonia, which is the responsible bacterium for serious respiratory infections. That is why pneumococcal vaccines play an important role in protecting the vulnerable populations such as young children, older adults, and those with weakened immune systems. It is important to remember that vaccines help to prevent severe illness and limit the spread of different life-threatening diseases within communities. Infectious microorganisms from a biblical perspective. He said, if you listen carefully to the Lord your God and do what is right in his eyes, if you pay attention to his commands and keep all his decrees, I will not bring on you any of the diseases I brought on the Egyptians, for I am the Lord who heals you. This passage emphasizes the importance of following God's command to ensure health and avoid disease. From a biblical perspective, the diseases are part of God's power and domain. The different types of infectious microorganisms, such as bacterial pneumonia, fall under the scope of diseases that God has control over and can protect humanity from. From a modern perspective, we can relate this passage with the moral values of getting vaccinated in order to avoid the spread of diseases, promoting both individual and communal health. And these are references. And thank you so much.